Have you heard about leucocovin for autism? Not enough professionals are talking about it, and a lot of prescribers won't use it because they're just so unfamiliar. So leucocovin is actually folinic acid. So how is this different than other types of like folic acid, folate, and what does this have to do with autism? So if you get a blood draw, you can actually see how much folate is in your blood, but it doesn't account for what's actually in your spinal fluid, the kind that's actually like getting to your brain and like doing the things for your brain. Some autistic people have what's called like an auto antibody, which is like going in and attacking folate. So it's not able to get into the brain and do the job it's supposed to do. It's supposed to be up there removing toxins and turning on the good neurotransmitters. It's supposed to be reducing inflammation up there, cell repair, growth, all of that stuff. Totally necessary for all of the functions. Folinic acid or leucocovin is like essentially like the high dose way to get those levels up. It is essentially a prescribed supplement. Folinic acid is also available over the counter, but at much lower dosages. It's not the same as methylfolate. Folinic acid is able to pass through those autoantibodies, so it's not getting attacked. It's able to get into the brain, and it's not methylated yet, so it's able to like do the processing and do all of the things and help the brain function. It starts helping with DNA repair. It starts helping with like making neurotransmitters, all that stuff. There are very few studies on this, and the only studies on it have focused on children, and I have like scanned the crap out of the literature. They found it helps with verbal communication, including for nonverbal autistic people. Irritability, aggression can be decreased for some. Help with focus. So, I mean, there's implications for potentially ADHD. Help with like more social engagement and more eye contact and feeling like you're able to better handle sensory input without getting overstimulated. Decreased anxiety, like reduction in some of the stimming and repetitive movements. Can take like several weeks to really start working, not an immediate thing. Subscribe to Brain Trash because we will have a full episode coming out on more of this, including side effects, all of that stuff, why you need to take it with B12 because it can be dangerous to take it without B12 or cause side effects without B12, how it relates to MTHFR, all of that stuff.